Okay, so what is she doing here? Now it looks very strange. It looks like she's trying to be some sort of zombie. But what she's actually doing with her physician here is she's trying to do the Romberg's test. And what is Romberg's test? Well, it's trying to test her sense of proprioception. So this is like there's many variants on Romberg's test, and what they're probably doing is the classic version, where first you have the patient just stand with their feet together, and depending on the protocol you're using, they say maybe like have them stand for 30 seconds and observe whether they're swaying or not. You can do it at home, but if you do it at home, make sure you have someone watching you in case you do start to sway, so that they can spot you so you don't crash into your furniture. Then they typically, after they notice, okay, are you swaying even with your eyes open? And then if you're not, then if you are swaying with your eyes open, then maybe there's something wrong with the cerebellum. And we will cover the cerebellum later on in the semester. But for now, let's concentrate on proprioception. So the second or no, classic part, after you see whether they sway with their eyes open, then you ask them to close their eyes. And then observe if they start rocking back and forth and swaying. If they start swaying to a very noticeable degree, then they might have a problem with their proprioception. And sometimes this is included as a third step. So if they're still not swaying, then you might ask them to raise their arms. And sometimes just raising their arms toward the front causes some people to sway. So you might be like, okay, they're kind of showing this sense of they're showing the signs that they might have a problem with their proprioception. So the interesting thing is that your overall sense of balance actually comes from multiple inputs and sensations. Or I don't know if you heard of your inner ear, but things like say you don't do any of these sports that involve a lot of spinning, like diving, gymnastics, or figure skating, and say you spin around a lot and then you stop. Typically, you feel kind of dizzy and woozy, and like the room's still spinning, right? Well, it's due to movement in the vestibule of your inner ear. So that's one thing that lends your sense of balance. The other thing is your sense of proprioception as well. And also another thing that contributes to that is your vision. So your vision is actually very important for your sense of balance. And so the thing, or if you've ever, if any of you wear glasses and you've had this new pair of glasses and you see how things are kind of distorted and you might be kind of off balance for a while because things seem kind of like the new prescription might affect your field of vision. Yeah, so this is all involved in your sense of balance. But by closing your eyes, you take vision out of the equation. Now you're just relying on your inner ear and your overall sense of proprioception. Now, proprioception, a sense of your body's position and movement. So the thing is a general sense because it's something that you don't really think about because it comes to you so naturally, but it's something you use every day, and it uses these proprioceptor sensory neurons, and actually you find them in multiple spots in your body, such as things called muscle spindles. They're within your skeletal muscle. Things also called their Golgi tendon organs. These are within tendons. Again, tendons are connective tissues. They're connected to muscles, but they're not the same thing as your muscles. So you have it within the muscles and the tendons, and also within these joint capsules. And we did talk briefly about mechanoreceptors. These are the ones that detect some sort of strain or stretch or distortion in their cell membranes. But the cool thing about proprioception, here we have a muscle spindle, and actually you can see that it's actually buried within this muscle right here. And what it detects is an overall stretch along these muscle fibers, and it sends the signals toward the central nervous system. Now, I don't think your textbooks have pictures of the Golgi tendon organs and these joint capsule, but notice that they're all involving the skeletal muscular system and joints. So this is one way you're able to, or what's this another example? Like proprioception is actually very important, especially if you're going a KRS major or involved in sports. Like when a baseball player is going to catch a ball or a football player is going to catch a ball, are they always looking at where their arms are? No, they're looking at the ball, but they kind of know where to put their arms where they're able to catch that ball. Or say a soccer player, when they're going to do a kick, are they looking at their foot as they're trying to connect with the ball? No, they're looking at the ball, but they know where to place their foot in order to kick it the way they want to go. Or even the non-sports example, like some if you're a dancer, well, how about dancers? Well, notice that they do practice in front of a mirror, but when they're doing a dance recital, how do they know without mirror that their arm is actually sticking out in the right position at like 90-degree, like parallel to the floor? How do they know they're doing the right movements without any visual feedback? Dancers have really good senses of proprioception because they know where their body is without actually having to look at where their body part is. So proprioception is that sense of body position and knowing where your body is in space, or even a smaller version. If you're able to type without looking at the keyboard, how do you know where your fingers are placed? I mean, if you're already set on your home keys and whatnot, how do you know to type a T, an X, a Z? Well, you kind of know how much to move your fingers by how like in what direction and by what degree. So that's also a sense of proprioception, just knowing where things are without actually looking at it. That's a sense of proprioception. So things like sports, dance, typing, these all involve a sense of knowing where your body is and where different parts of your body are in order to carry out functions in your daily life. So it's some sense you use all the time, but you never really quite think about it as much as your other senses, or it's not as flashy and noticeable as your sense of vision, taste, smell, or any of the other sensations. All right, so I think that's it for today. We'll cover the rest of this on Monday.